They say their mom just couldn't hold on any longer. Tonight, there's a renewed focus on depression and mental health in the wake of the untimely passing of Naomi Judd. Naomi Judd went public about her battle with extreme depression and anxiety back in 2016.
Her daughters this weekend said they lost their mother to the disease of mental illness. Let's get out to Priya Mann, who's working this tonight. And Priya, this is putting the spotlight back on an issue that certainly needs attention.
Yeah, and there's no better time, Jason and Karen. May is Mental Health Awareness Month. We spent the day talking to licensed therapists who say they're encouraged by the push to normalize conversations about mental health, but that's not always the case when it comes to suicidal thoughts.
I'm a loss survivor myself, so I've lost 2 family members to suicide, and I can tell you that what the messaging is really important right now.
Melissa Tolstica is a clinical director at Hagira Health, which serves 20,000 clients every year.
If a person is thinking about suicide, they'll let you know. They'll tell you if you ask that question.
She says recognizing the warning signs can save lives. Verbal clues can be direct or indirect, like someone saying, "I don't want to be here." Behavioral signs can include withdrawal, isolating, and losing interest in hobbies. And situational examples could be someone getting fired from their job or expelled from school.
I'm seeing that a lot more, that people are wanting to talk about these things that we didn't want to talk about before.
Kelly Mays is a licensed therapist and, like many, is seeing a troubling rise in depression and anxiety, especially among young people. She says if you're worried about a loved one, try QPR, a simple 3-step method. Question, don't be afraid to ask. Persuade, suggest calling together, and refer. Know the referral sources in your community.
Most people who want to die or who think about death or think about suicide, they don't want to die. They don't want to live. They just are in pain. And they want that pain to go away.
And the most important thing you can do is talk about it. Here are 2 important resources for you, so write these down. These can be life-saving resources. The crisis text hotline, you can text HOME to 741-741. It will connect you to resources right in your community. And the suicide prevention lifeline is 1-800-273-TALK, 1-800-273-8255. And of course, if you are struggling, please reach out. Reporting live tonight, I'm Priya Mann, Local 4.
Yeah, and we have seen just how valuable that hotline can be. And Priya, we've talked before, too, about how the pandemic only exacerbated this problem.
Yeah, that's right, Jason. And therapists say COVID has had some unique consequences. They're seeing young people who are expressing a lot of anxiety about re-entering heavily populated areas. Parents are worried about their kids. They're also worried about getting back into society and the workforce. So again, seek help and talk about it. They want to normalize these conversations, right? We don't think twice about talking about a broken elbow. You can talk about what's going on in your mind as well. Send it back to you.
100%. All right, Priya, thanks.